Um, our speaker for tonight is Laurel Beaver. Laurel Beaver is a LPC, a licensed professional counselor. She is a suicide prevention specialist at the Center for Suicide Prevention and Research and a mental health counselor in the Behavioral Health Department at Nationwide Children's Hospital. Laurel has been at NCH for 10 years and in the mental health field for 24 years, working with multiple populations. She has particular interest in working with schools and community organizations to increase awareness of suicide and help others understand how we can all help prevent suicide in our youth. All right, so without further ado, I'm going to turn it over to you, Laurel, and you can take it away.
Wonderful, thank you very much. I'm excited to be here and am also very aware that this is a very sensitive topic. So be kind to yourself tonight. If something hits you in a way that you're struggling a little bit, take a moment, get up and do something, take a little walk, get something to drink, whatever you need to do, please take care of yourself, because this is difficult material and a lot of people have really been impacted by this personally. First, I want to just kind of review where I work and what kind of things we do in the community. So I work for the Center for Suicide Prevention and Research at Children's Hospital. And what we do is, one of the main things we do is we go into schools and help them learn how to put a prevention program in place. So we teach the schools how to present the material to their students, and then we're there afterwards to help and see if there's any students that need any attention regarding possible suicidal thoughts or depression, things like that, to help the schools understand how to work with them and then provide risk assessments and things like that as needed. We also work with schools on postvention. So if a community has unfortunately experienced a suicide, a lot of times they will contact us, and we will also reach out to them and help them figure out how to handle, how to communicate, what things to do and say to help the community start to heal in a positive way. Another thing that we do is these gatekeeper trainings, basically very similar to what I'm doing tonight, really helping the community understand what the warning signs and risk factors for suicide are, what they can do, what each person can do to actually help with this prevention. During these interactions, we want to help reduce the stigma around mental health and build mental health awareness. We want to help people understand what natural supports they have around them and what different coping strategies are that can help them. And then they can also let their kids know some of these items as well. We highlight really a connection and values and reason for living as important parts in suicide prevention. I think the part of our mission statement that really encapsulates what we do is we engage each community member to understand their role in preventing suicide. So each of us has something that we can offer to help our community and kids. Specifically today, we have a couple goals. I want to lay some groundwork and really help you. I'm going to tell you what the different statistics are for depression and suicide in our community and in the nation. We want to look specifically at what the risk factors and warning signs are for suicide. We'll look at what protective factors our kids have or that we need to help build within our kids that can help with not having suicidal concerns. We also like to really teach how to build a culture that values mental health. We're going to talk a lot about that. It's really important for our kids to understand that mental health is a medical condition, just as any other physical condition there is, like diabetes or heart disease, breaking a leg. All of these things are physical conditions, and depression is as well. It affects our bodies, our brains. It's part of, the brain is the biggest organ, right? So it is a medical condition just as much. And we want people to really understand that to help destigmatize. We're going to help talk about how, how to talk with kids that may have some suicidal thoughts or concerns. Then we'll touch on also how to interact with schools or places that our kids are going to be to help safeguard them at those places as well. Then at the end, we'll take some question and answer. To get started, I'd like to just kind of review some simple definitions because it may seem straightforward, but there's little variations here that are important distinctions to make. So suicide is an actual death that is caused by someone doing something to harm themselves, to inflict injury on themselves and death on themselves with the intention to die. That statement is very important. The intention to die has to be in there for it to be a suicide. A suicide attempt is somebody doing something to harm themselves with the intention to die, but it might not result in any injury. So depending on what this is, if you have someone that doesn't understand about medications and what quantities are difficult or more troubling, if someone takes one aspirin thinking that that's going to kill them, then that is considered a suicide attempt. It has to do with the intention. It may not result in any injury, but we need to pay attention to that because suicide attempts put people at greater risk for additional suicide attempts. And then suicidal ideation is a fancy way of just saying thinking about or considering or planning suicide. And then self-injury, I want to put this up here, although it is not suicidal act. Someone that self-injures is doing something to purposely harm their body, but the difference is they're doing it without the intention to die. It can be confusing at times, though, because someone that self-injures could also become suicidal. And so they may have both at the same time, but there are many people that self-injure that never have any intention on actually trying to kill themselves. We do worry about it, and we do want to get those kids help as quickly as possible, because once people go into the mindset of doing something physical to harm their body, it puts them at risk for then escalating it to something where they could attempt suicide and think that harming their body is a way to actually solve problems. So I'm going to start with these statistics. These are national statistics. And often they surprise people. Suicide is the second leading cause of death for our kids these days. Kids from 15 to 24, it's been second leading cause of death for some time. But just in the last decade, the suicide deaths in 10 to 14-year-olds has tripled in the last decade. And so just this last year, it raised to the level of second leading cause of death as well for that age range. To put this in perspective a little bit more, when you think about the leading causes of death in our kids, ages 10 to 24, the 6 main leading causes of deaths are listed here: stroke, flu and pneumonia, lung disease, birth defects, heart disease, cancer. And what is really troubling is if you add up all of those medical conditions together, they don't even equal the number of kids that die each year by suicide. So we absolutely want to invest in research for all of those medical conditions. We haven't been as aggressive in our country as putting research dollars into suicide, and that also needs to start to take place a little bit more.
Laurel, let me interject for a second and speak to just the role of the Center for Suicide Prevention and Research, right? Because so much of the funding and the research has not been done, we are really doing some pretty innovative work, right? And that we're really taking, I think, a aggressive step to really start to do some of those, to really start to research and really get some good data, because I think this slide really certainly highlights the cause. And I think if suicide was something else like cancer or birth, you know, there's a lot of money and some of these other things, which is awesome. But I think it really helps to highlight how we really need to get a little bit more aggressive in terms of our role here. So it's exciting to know that's happening in our community. So I just wanted to pop in and mention that.
Absolutely. And thank you for reinforcing that. I don't think people realize how much prevalent suicide is in our country. I think these days, more and more, we're hearing more about it. It's becoming more publicized. And as part of our program, we actually help figure out how to publicize it in a responsible way. Because what we have found in the past is there's a lot of people that put out messaging that actually then could lead to more suicides. But so our department actually has really worked at helping media kind of understand what the important things are to focus on with that. But as we go forward in a slide or two, I'm going to show you how right here, these numbers are about the actual suicide deaths. We're going to look at then how many additional people, when we think back about those definitions I just told you, of how many people are actually thinking about it, of our kids, how many are thinking about it, how many are actually planning it, how many are actually attempting, and add that to how many actual deaths we have. It's significant in our community and country and actually world. Does anybody know what the leading cause of death is? Accidents. Accidents are the leading cause of death. And when you think about accidents, there are plenty of people that die, and it's considered an accident where it may not have been recognized also as a suicide attempt. It's not always clear. And when it's not clear, it's going to be ruled an accident. And then also an important part to think about when it comes to accidents, over the years, our community, our society, our country has really invested some money in education in how to reduce automobile accidents. That was a big leading cause of death when it comes to accidents. And through the education, through having speed limits, through having cell phone restriction when driving, seat belts, all of those things have actually been out in the community, and it's really proven that with that research and with that focus, we've been able to reduce those numbers significantly. So again, it's another reason why we need to think about how can we get suicide research as suicide prevention research as a paramount issue. This is another troubling slide. Even children under 12 years of age plan, attempt, and complete suicide. So I just told you that 10 to 14, that's now the second leading cause of death, but it's the 8th leading cause of death for children under 12. It's very surprising to a lot of people. It's devastating, obviously, but it's very surprising. In 9 and 10-year-olds, a recent study actually showed rates of suicidal thoughts were 6%. And it's in 9 and 10-year-olds. And attempts were actually 1% of all 9 and 10-year-olds. So these numbers are reducing, I'm sorry, the ages are reducing in who is being affected by this as well. A lot of people think kids don't even know what death is. How can they actually think about wanting to kill themselves? The point is, in that moment, they're feeling pain and they don't want to live. And if they go forward and take some action, they don't necessarily understand the permanence of death, but they don't need to understand the permanence of it for it to still have a major impact and actually lose a child to suicide. When we're talking about older kids, people start to understand that this is more common with our middle schoolers, but really high schoolers. The earlier that we can get in there and do education on this, the better, because you can see with, it's even kids 9 and 10-year-old are dying by suicide. Actually, at Children's Hospital, a couple years ago, we had a child 8 years old that died by suicide. But when we're looking at suicide and depression in high school students, I want to think of it, I'm going to give you 2 different numbers here. One, a national statistic. In a given year, in the year of 2019, a report came out and showed in a given year, this is what was going on in high schools. But then I'm also going to give it to you in a frame of reference of within a classroom of 30 students. I think it's easier to kind of visualize and understand that as opposed to a statistic of the whole nation. So 12 kids out of 30 have felt so sad or down in the past couple weeks that they stopped doing some type of activity they usually do. That is a major sign of depression. 2 weeks or more of a change in significant behavior with multiple different characteristics. 6 out of 30 kids, or 19% nationally, have seriously considered attempting suicide. 5 out of 30 in a given classroom has actually made a suicide plan. So you can see how this progression of, okay, feeling down to maybe I'm going to do this to actually forming a plan. And then the last one, 3 out of 30 students, 9% of the population of high school students has actually attempted suicide. Those are numbers that are coming to us from the CDC. They go every 2 years throughout a vast majority of high schools and do this risk behavior survey. And one of the things that they're looking at is mental health concerns, including depression and suicide. So it's really important that we are talking and we're getting into schools. Dublin has done an amazing job at embracing suicide prevention in your schools, and they have a wonderful program there. With all of that heaviness, I want to just give you a little bit of hope here. So with all of that tough news, the good news is that suicide really is preventable. We know that if we can catch it and get kids into treatment, whether it's therapy or medication or a combination of both, but then also with our community becoming aware, each one of us understanding what the signs are and what we can actually do to help this is important. And I really see that growing each year. It's very, very comforting, not comforting, it's really exciting to see how our community, our society in general, is starting to embrace taking some responsibility for this. So one of the facts with suicide is that people that are depressed and use alcohol or other drugs are at greater risk for suicide. Seems to make sense. And why is that? Alcohol actually leads to a person's depression. We know that Alcohol is actually a depressant. And so it's going to, if someone is already having depression, it's going to add to it even more. And then alcohol and drugs add to really making poor decisions and increasing the chance that someone's going to act on those thoughts that they may have been struggling with. Actually, drinking while down increases the risk of suicide by 75%. So, and alcohol is the number one drug that kids or teens use. So, you know, kids are going to experiment here and there, but we need to be really careful if our kids are struggling with some type of mental health issue, that we're keeping a really close eye on that as well. Let's start to look at some of the risk factors for suicide. There are 3 top risk factors. One, you can probably already guess because I've been mentioning it quite a bit, is depression. And we're going to talk more about the specifics of depression in a minute. But someone that's depressed is at great risk for suicide. Let me say that a little differently, though. Almost everybody that dies by suicide has depression. 90% of people that die by suicide have some type of mental health condition. Most people that have depression don't have suicidal thoughts. So it's a tricky thing here. We want to really pay attention to if someone is depressed, because it puts them at greater risk. But just because someone's depressed doesn't mean they are suicidal. And it's an important thing for us to take into account. We're going to talk more towards the end about communication. And so, you know, if our child is struggling, that's just opening the door for us to be able to talk with them and get information from them and not shy away from direct communication. Other top risk factor is alcohol and drug use. And then the last one are previous attempts. If we think about previous attempts, a lot of times people feel really relieved when someone is getting the help that they need. They go to the hospital if they're suicidal or having significant mental health concerns, go to the hospital, have an inpatient stay. Most people think, great, okay, they're fixed. That's not the case. That is dealing with the crisis, the real work. The significant more amount of work happens after the hospitalization. And that is still a time where they're at greater risk of reattempting, particularly in the first couple years after coming out of the hospital. So we have to stay vigilant and stay communicating. Other risk factors for suicide are psychological aspects. You know, that can be just the negative view, someone that has suicidal thoughts or depressed, the negative views they have of the world, of themselves, of everything that's going on, loneliness, and then behavioral issues are also a risk for suicide. Younger kids that have ADHD may not have depression, but kids that have ADHD are at greater risk of attempting suicide because they lack that impulse control. And so we're just always needing to check out. We're going to talk more about communicating, always checking things out, and always taking it seriously if someone's threatening to themselves. Biological considerations. So gender plays a role in how boys are 4 to 5 times more likely to actually attempt suicide, die by suicide. But girls are 2 times more likely to actually attempt suicide. And so what's the difference there? You know, how is that working out? Boys tend to move towards more lethal means, attempt to kill themselves in a way that is hard to bring them back from, like guns or hanging, things like that. Girls are more times than not use something like overdosing, which we can then intervene. We can find them and intervene and have a much more success rate at them not dying. So that's the difference there. Unfortunately, the group that is increasing the most in suicide deaths recently are girls that are between 10 and 14, that same group that we had looked at that are now second leading cause of death. And that's mainly because they're moving towards using more lethal means, some type of asphyxiation or hanging. So we're going to talk later again about how we kind of safeguard our homes, our kids, about how if they are struggling with depression or suicide, how we safeguard them from that happening. Also, distress related to being LGBTQ. So just because someone is LGBTQ does not mean just that inherently doesn't mean that they're at greater risk. It's the distress related to it. Are they feeling accepted, particularly by their own family? If they're not feeling accepted by their family, the risk increases greatly. But just in general, they're at greater risk for even just community recognition of whether they're approved of or not. And then genetics. So there are some that are predetermined, predisposed, predisposed to depression through genetics. And, whenever someone comes into therapy, starts in therapy, we're going to always be doing a full history on them. And, looking at, is there a family history of any of this? Because it does play a role. And then what are the environmental implications when it comes to risk factors? Having access to things that can be used to try to kill themselves. Huge risk factor. And that is luckily one of those things that we can control most of the time. History of having some type of abuse, whether it's sexual abuse, physical abuse, emotional abuse, that increases the risk for suicide. History of being bullied puts someone at greater risk, but also the person that bullies them is also at greater risk for suicide. Not as of greater risk as the ones that are being bullied, but they're still at greater risk. And why would that be? Can you imagine that person that's bullying someone feels very good about themselves? What's going on there is, could be part of that. And then knowing someone that's died by suicide, whether that's somebody in the family, whether it's somebody in the community, whether it's somebody in the school. Actually, people that are on the tier out of really good friends are at greater risk than the friends that are in closer in. The ones that are closer in actually experience what that loss is like for everyone else, and they see the ramifications of it. People on the next tier out don't experience it the same way, and they are seeing that, oh my gosh, that is a way out. And there's something called suicide contagion, particularly with our youth, our teens, that we need to pay attention to. If something is happening around them, that we're also checking in with them. All right, let's talk a little bit more specifically about depression. So the important thing about remembering about depression is these are several changes, major changes, that will be going on in different areas of someone's life for 2 weeks or longer. So we're going to talk about what's the difference between sadness and depression. That's one of them. It's the amount of time someone is experiencing these feelings and behaviors. So depression has a few different categories, right? There's physical sensations, symptoms to depression. People actually feel like their body hurts. Their bodies will hurt. There's chemicals going throughout the body when the brain isn't functioning properly, the neurotransmitters are not functioning properly and actually send signals to the different parts of the body and actually can hurt. There's weight changes, whether that's going up in weight or down in weight, appetite changes, some of those physical considerations. And then also sleep, problem sleeping or sleeping too much. Before I go into this anymore, I just want everybody to stop for a minute and think, what does depression look like? If I think about somebody that's depressed, what does that person look like? So I've already kind of reviewed what the physical symptoms are, but what else do you think they would look like or act like? Anybody have a kind of a sense of that? I want, feel free to share too.
Someone mentioned that it doesn't look like any of us, right? So, right, I think oftentimes we see people functioning pretty well, and we think that things are okay. And I think that can be a concern, right? Is that I think we oftentimes think of depression as a kid who won't get out of bed, or that, they physically can't move, which I think sometimes perhaps we see that in adults more than adolescents, that we see more of the irritability, right? Or some of these other pieces in adolescence that may look a little different. Some of the other folks in the chat were saying overcompensating for things. They look great on the outside, like everything's okay, which I think brings you to this point about our perception of depression. If we don't think that's maybe going on, we may be quick to sort of dismiss some of those other things.
Yes, absolutely. And, there are a lot of kids that do just on the outside look like they've got it together. But what we need to be paying attention to, and we're going to talk more about it, are some of the warning signs that are shown. And, with depression, the thoughts turn much more negative. So they may be able to say the positive things to other people or hearing them, but typically once they get home and they are away from the crowds, that's when they can decompress. What are they acting like? Are they acting a lot differently? That is the biggest key, is if you feel like there's a significant difference in how they act. Feelings wise, I'm really glad you brought that up, Amanda, because most people think of sadness as depression as this sadness, but in particular with younger kids and even teenage kids, that irritability, that acting out, bullies, right? That can also be part of that. They're acting out, they're mad at everything, they're mad at the world. That's that negative view of the world. They can also feel really guilty and ashamed that they're feeling that way. So there's so many different variations when it comes to what depression actually is and looks like. It's not one size fits all. And the behaviors can be difficult too. As a clinician, I have people come in with their children and they'll say they're just not getting their homework done. Well, they may not have the motivation, and or they lack concentration, they lack focus. That's all part of depression. Their body chemistry changes, and so that really affects the mind that way. It's a mind-body connection.
Some other folks talk really quickly about losing interest in things they used to like to do in the past, or even folks who may just say, yep, I'm fine, that nothing's, horrible and nothing's terrible, but they're hesitant to really share those feelings. And I know you're going to get to that in a minute, but I think that that's another piece of this, that they're really not giving you much, which I know you'll cover a little later too, but good points.
Yeah, absolutely. Really good points. And, we have to really be paying attention to what we really know. What are we actually seeing? What is our gut telling us to? I'm not saying just always follow your gut, because it has to be more than your gut. But if your gut's telling you something, look at what's going on around you. Dig in a little bit more. Now, specifically, there's a big difficulty in people understanding the difference between sadness and depression. And I think you hear it a lot, particularly with teenagers. I'm so depressed today. Well, being depressed today isn't depression. That's being sad for the day. That's having a bad reaction to a situation. That's not a formal depression. Depression is something that lasts for a couple of weeks or longer, that needs treatment in order to get out of. It's not necessarily sadness. They may feel sad at times, but more times than not, when I have a client in my office, what they're feeling is numb and feeling nothing at all. And so if you're feeling nothing at all, do you really care about getting that homework assignment in? Nope. And on top of that, you're thinking really having negative thoughts about yourself, and you're feeling anxious, and you're feeling guilty, and you're feeling hopeless. You're isolating. You're not doing the things that you normally enjoy doing, and doing them, and the things that you are doing, you're not enjoying. That's what depression is. People can make themselves do things, but it doesn't mean that they're enjoying them and really having a full life with that. So let's talk about some warning signs now. I said this before, and the biggest warning sign is acting differently than normal, than usual. Are you seeing significant changes? So you have someone that absolutely loves basketball all of a sudden, like, I'm not trying out for the team this year. Now, if they say that and they're said, because I really want to play soccer this year, that's not something to worry about. That's a change in decisions. But if you have someone dropping basketball and hanging out in their room by themselves, or hanging out with a different crowd of people that, maybe aren't doing positive things, those are some more things to be looking at. If someone starts to do something like giving away important belongings to friends or family members, making sure that loose ends are kind of tied, saying final goodbyes to people, those are big warning signs. And as I put it on the screen, I'm sure it makes sense. Oh yeah, they're getting ready to do something. But it's not always that clear cut in the moment. So again, this is a lot of different pieces kind of coming together all at once, at the same time. Increase in risky or reckless behavior. Are people beginning to use substances that they hadn't before? Are they using them more than they used before? Another couple things about risky behavior: are people starting to drive recklessly when they didn't before? Do they care if the car goes off the side of the road? Are they self-injuring? Again, we talked a little bit before about self-injury, but that is a warning sign. It doesn't necessarily mean they're suicidal, like I said before, but it is a warning sign that something significant is going on with that child, and they need help. They need professional help as well for self-injury. Wanting to be alone all the time, not wanting to be around people, not being involved in things that they usually enjoy, or any kind of interest in other activities. It's a paucity in being involved. It's not necessarily a changing your mind of something that you enjoy or not enjoy. It's when you're not having things filling your time to add to your life. Most people who attempt suicide give some type of warning sign that they're thinking about suicide. That's why we're really wanting you guys to be aware of what the depressive signs are, what the warning signs are. Like I said before, 90% that die by suicide have some type of mental health condition. And so looking at those depressive symptoms and trying to catch that ahead of time. I see something come in. Oh, you're on mute.
sorry about that, that you can see that they are stressed and feeling hopeless and helpless. So there's some visual cues there. And if they have ADHD, they are at a higher risk of suicide because of comorbidity of depression, anxiety, rejection, sensitivities, disorders, etc. But they are very spontaneous and don't think things through. The warning signs are usually to their friends, not their parents. Excellent points, which is really the hallmark of what you guys have been really working on, because those are absolutely true points. Absolutely.
Yes. And, you know, we like to do these caregiver evenings. We like to give these gatekeeper type trainings because we want parents to really understand and know what's going on. But that's also our main job, is to go into schools and help schools put these prevention programs in place year after year after year, because we know that kids are more likely to go talk to other kids than they are necessarily to adults. We'll get more into that in a minute, but all those are really great points. Thank you for sharing. Another fact is there's a lot of ambivalence about death. It's a very common in suicidal people. Most times they don't really want to die. They don't want to be dead. They just can't continue living with the pain that they're in. So, you know, with suicide is preventable. And I mentioned earlier about restriction of means. That is really important, because what we know is that someone that's depressed or suicidal, that suicidal thought isn't a constant thought. It's not always right there in front of them, always considering, contemplating. But when it does appear, it's huge. And that is when suicide attempts typically happen, is when they just feel like, I can't take this one more minute. It's just right there. And so if they say, okay, I can't take this anymore, and they don't have any way to actually try to kill themselves, we're saving them. So if you have someone that's depressed and or suicidal in the home, and even if, you know, their friends come over, you don't know who's going to be around, have your medicines locked up. There is a huge increase in amount of deaths by overdose of over-the-counter medicines, because people will pick anything. They're not like thinking, okay, this one's going to do this or that's going to do that. We want to make sure all medicines are locked up and out of access to our kids. Whether you keep those in a lockbox or whatever it is. Firearms in the home. I'm not saying anything about the political aspect of firearms. What I'm saying is, if you have them in the home, have them locked up. That is the number one means of death by suicide. It's because it's so fatal. If we lock those up, they're not going to have that option. And what research has shown is that if someone has one thought of how they're going to kill themselves in the moment, and they go for that item and it's not there, they don't just turn around and then go find a different way typically. Like I mentioned earlier, the suicidal thoughts will eventually start to subside. So what we're trying to do is get them through that period of having that suicidal thought. So taking things out of their access is really important. What takes someone from actually thinking about suicide to acting on that? That's what we consider a triggering event or a precipitating event. So the difference that I want you to understand is that there might be something that triggers someone from thinking about it to acting on it, but it's very rare that someone's going to actually do something without some underlying mental health condition. There's usually something else going on. It's not just an actual event. Now, like we've already mentioned, there is the piece of ADHD and the impulsivity. It can happen, but it's much more rare than someone has a mental health condition. And actually ADHD is a mental health condition, right? So let's look at some of the events that are significant that we have found are, more of the bigger reasons that have taken people from thinking about actually attempting. Relationship issues and loss. Those are the two major triggers for suicide: relationship issues and loss. Also, even being bullied, we said, is a greater risk. Feeling rejected, like a lot of LGBTQ people that attempt, feeling rejected. Perceived failure. If someone is really considers them a really high achiever, and they start to slip, or there's a concern for not making the team or not getting in the right school or whatever, those could trigger someone. And it's easy for us on the outside to say something like, this is just one moment in your life, you're going to be okay. That's not what they need in those moments. What they need to know is that we care and that we hear how much pain they're in, and get them the help they need if they need additional help. Also, family stressors like divorce, jail, deployment, and financial issues are things that can take someone from thinking about suicide to attempting. And actually, with teenage girls, one of the biggest predicting factors is transient relationships, not having a consistent group of friends. That is a big factor when it comes to teen girls.
Laura, I'll also mention, someone put in the chat, changes in medication potentially. So some changing potential ADHD medications can potentially cause some suicidal thoughts, especially if they're not working well to help them focus in school. So again, maybe potentially like a medication change may also be some sort of shift that may lead to potentially more acting out behaviors potentially.
That's really great. Thank you. Whoever is putting in those comments really seems to have either done a lot of research or has unfortunately experienced some difficult things. And so your input is really valuable. Thank you.
Personal experience. Thank you, Jared.
So when we talk about so we've kind of reviewed the triggering events. But again, like in the news and things like that, we've heard, oh my gosh, that person was bullied to death. I mean, not too far off. That was just some headlines, right? Or the person died because someone broke up with them. We need to take it out of that context, because that simplifies things way too much. There's almost always, like I'm going to say it over and over again, some underlying mental health condition like depression or anxiety going on, and ADHD. So youth who talk about killing themselves are more likely to attempt suicide than youth who don't. What do you guys think about that? I've heard people say things like, oh, they've said that over and over again. They're not going to do anything, or they're trying to get attention. Yeah, they want attention. People that do talk about it, like I said, people that die by suicide almost always are given some warning signs. This is a clear statement of it. And so we always need to take it seriously. Even if it is the 20th time somebody said it, we need to take it seriously each and every time and make sure that person is safe. And if they've said it 20 times, they definitely need to be getting some help on how to express themselves differently if it's something that they're just saying, which typically it's not. Or if they're depressed, they need to be getting some treatment. Like I said, we don't ever want to ignore it. I'm going to take a couple minutes and show a video that I just really absolutely love. It speaks directly to parents from a teen's experience. And I show it later in the presentation because you wouldn't need me so much if I showed it in the beginning. Now, I have to remember how I did this last time. So I need to do stop sharing.
Yes.
And then
Share your different screen.
oops. Nope. There we go. Getting quicker.
And downs, just like
Can you hear
anybody
it?
else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual,
Acting really down, crying all the time for no good reason.
Or getting really mad, not able to sleep, or sleeping too much,
Shutting her friends out or giving her stuff away.
acting reckless, drinking, using drugs, staying out late,
Suddenly not doing stuff he used to love.
or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
or it might be something more. He might be depressed.
Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself. It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to
I
me.
wish he'd said
I
something.
wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out, are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask. They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask.
In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes,
Well, here's what you don't say.
that's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing
Yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself. What you do say is,
I'm sorry you're feeling so bad. How can I help?
We'll get through this together.
Let's keep you safe.
a lot of people think about killing themselves, adults and kids. Most of them never try it, but some of them do. So if your kid says,
I'd be better off dead.
I can't live with this.
I'm gonna kill myself, take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure. But sometimes it goes deeper, and it's not going to go away by itself.
Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
But don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts.
Make a list together right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe.
If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut, because it never hurts to ask.
And it can make a big difference.
All the
difference.
In your kid's life.
I saw something today, Laura, that I was reading something about this, and they had said that people aren't looking for attention when they talk about suicide. They're looking for support. And I thought that was a really powerful way to think about that, because I think we do oftentimes think about, it can seem very attention seeking, especially if it's something that's been said more than once. And so I think if we can maybe think about it as more of someone's needing support versus attention, that can have a different sort of connotation to it too.
Yeah, that's a really great reframe. Because like I said, people don't want to die. They just can't do it anymore. It's just has gotten too much.
Someone in the chat says, I think the hardest, most necessary thing as a parent or school staff is to ask that hard question. Do you want to hurt yourself?
And it's important to know the difference. And so saying, do you want to hurt yourself is a really great question. And you also want to take it a step farther and say, do you want to die? Do you want to kill yourself? Because hurting, this day and age, well, it's always been around, but self-injury is much more prevalent. And their understanding of harming and dying are two completely different things. So we really want to spell it out and be very clear, and ask that hard question. It is extremely difficult for a lot of people to say. And it's because we have so much stigma. Well, I'll wait till more of the, I have a few more slides for you, but I think a couple people are chiming in.
Yes. And so also asking if you have a plan, right? And an interesting tip I've heard lately is to put the crisis text line in your kids' phones, because many kids are more willing to text these days than call. The crisis text line is 741-741. She read your mind, Laurel.
That's you know what? I love that people are just knowing this stuff. And whether they're texting for themselves or they're with a friend who is feeling really bad and they give their friend that number, or they sit there and text with their friend. When I'm in session or when I'm doing a risk assessment, sometimes I'll have them practice. We'll actually call the suicide hotline together, or we'll actually, text the text line so they know what it's like, so there's not that fear piece to it if they get into that situation. So yes, having that, and almost all kids have phones these days, so I also have them take picture of a safety plan. When we create a safety plan, I have them take a picture of it so they have it there to be able to reference. Whatever we can do to help them in the moment, because it's a lot harder to think about these things when you're in a crisis. So be able to read something through is important.
That's also, someone said that there's a song that gives the number in the song title. You may know that. I love that. That's a great idea. So just like, like all those songs that get stuck in your head, it's that's maybe what one comes to us. That's awesome.
It was a couple years ago that came out, and I was so happy about that. That was really exciting.
So teens are, I'm going to say one more thing before we move on. Teens are pretty callous on chats. They tell each other to kill themselves, or every time they're upset, they say they want to die. Teens are not counselors, but they end up begging each other not to commit suicide. And that's a lot of pressure for a kid. Absolutely. That's a great point too.
And with the suicide prevention that we help in schools with is the signs of suicide. And what they have is called the ACT message. What we're teaching the kids is the ACT message. So acknowledge that there's a problem, either in yourself or a friend. Show them that you care. And then tell a trusted adult. Now, we're going to talk later about when our kids go leave the home or leave high school, they need to change that T of tell a trusted adult into T, let me get some treatment. Doesn't mean they can't tell another adult, but also moving them more towards being adult. But yeah, and we need to help our kids understand that they cannot take that burden on as a friend is doing that. We need to let that parent, that child's parent, know what's going on. It's a really difficult place to be in these days. I don't know about Dublin, but there's not like phone numbers listed for parents and kids. my daughter came home one day and I was talking to her about what I was doing at work that day. And, I just every once in a while give her a plug about it. And she's like, you know what? My friend the other day said that they were going to throw themselves down the steps. I'm like, oh, to try to kill themselves. And so, I've got more information. I'm like, well, what is the parent's name? Of course, my daughter had no idea the parent name, didn't know where the kid lived, didn't know anything. I was on the phone for a couple hours reaching out to other parents to say, do you know this other kid's parent? Finally, I found somebody, which was great. And I was able to call and talk to the mom and let her know. And luckily she told me, she's like, we just got into some services. So the mom was aware that their daughter was struggling. But we need to follow that through and let our kids know that you can't burden this yourself. It's tell a trusted adult. You need to go to somebody that's a responsible person. And sometimes you go to one, they may not listen. So you got to go to another and you got to go to another till somebody actually listens, because not all adults understand this information.
Right. So the idea too of putting that kids' friends need to have your phone numbers. So if you have a friend, to make sure that the parents' number's in there, to get your kids' friends and get their cell numbers, because none of my friends contacted me to tell me, right? So potentially the same situation. How do we, kind of make sure that link is connected? Because you can feel very powerless if you don't have the contact information.
Great idea. I wish you were around when my daughter was growing up. Yes. But really great suggestions. Thank you. So let's talk a little bit about protective factors. So what are the things that protect our kids from developing suicidal thoughts or depression? What are things in their lives that protect them? Well, first of all, before we get into their what they have, what we model to them is extremely important. Are we modeling how to take care of ourselves? Are we modeling that appreciation for what people are, who they are, specifically with individual characteristics, helping our kids really understand and know what makes them special. That's what self-esteem is built on, who they are as people, not what they do, but who they are. What are the characteristics of them that make them special? And by actually telling them, just seeing it, our kids don't necessarily always connect the dots. So if you see them being kind, you see them holding the door for someone, tell them that was really kind of you, or sharing their candy or whatever. Or if you see, if they're being funny, letting them know that they have a good sense of humor. Pointing out the things about them that make them a special person is really important to do. Family and support systems are a protective factor. Family, so first of all, one of the fundamental protective factors is talking to your child. Talking to your child is a huge protective factor, and not just chit chat, and it can be chit chat as well. It needs to be both that and really delving into what they're experiencing in the world. Support systems. Schools is a great support system. Churches are great support systems. Leagues that they're on, whatever it is that they're doing, those are great support systems. Restriction of means. I went through that pretty thoroughly. That's a protective factor. Mental health care. If they need it, do they have access to it? Luckily in Dublin, you guys have amazing resources for mental health needs. There's a tiered level of care that you can get within Dublin schools. Is it needing just a little help doing some things? Is it someone that's struggling with more mental health concerns? Or is it someone that's in a level of crisis? They have different tiers of support for each one of those. And a lot of different supports. It's not just one particular place, which is really wonderful. that once someone does get into services, that therapeutic support is a huge protective factor. All right, so you do not cause a person to consider killing themselves by talking about suicide. They went over that in that video. Wasn't that video amazing? That was just a great video. It says it so succinctly. And this is one of the reasons why people don't ask. This is a common myth that's been out there for years and years. Hey, if I say something to my child that I think might be depressed or really sad, if I say something about depression or about suicide, it's going to make them think about suicide. It's going to make them attempt suicide. No, we know absolutely that's not true. By actually recognizing that your child is struggling, it gives them an opportunity to get help. Many times, as a therapist, what I'll hear is it's just a relief for someone to know that they're struggling with those thoughts. There's a lot of shame involved with having thoughts of suicide. There's a lot of guilt. There's worrying that they're going to get in trouble. There's worry that they're going to upset their parents, that it's going to make them feel bad. There's so many different parts about suicide. It's not that they're just trying to keep something from you. It's a complex, in-depth problem that has a lot of different variables. And, you know, I'm going to share a story about my daughter in a minute, but we might think we might be doing all the right things. But that communication piece is key. So bringing up the subject of suicide and discussing it openly is one of the most helpful things you can do.
So this would be true for people who, you know, maybe their kiddo isn't experiencing or showing any signs. Like when we think about the risk factors and things like this, you know, is it good to start those conversations with kids who seem to be functioning well, right? Who maybe we wouldn't think this is happening, right? Or that there wouldn't be concern. So, if, you know, if we're hearing you right, bringing these things up would not cause, you know, negative outcomes. It would help to really help to underscore what you're talking about, which is opening up that communication. Is that?
Yeah, and the younger, the better to start talking about this stuff. Don't make it a, well, I have to say something that's not, I don't know. I'm trying to think of some way of saying, don't make it a really bad term that is not considered something that you can talk about. Make it be something that, you know what, our world has this, our community has this, your school has this. People struggle with depression and suicide. And the sooner we can start talking about it, they're going to be hearing about it anyway. Or seeing it somewhere, or reading about it somewhere. I mean, the books and things that our kids are reading have that information in it already. You're not going to be giving them a novel idea. So the sooner we can start to talk about it, the better.
So someone in the chat was kind of mirroring that. It says, is it okay to see or read documentaries, books on the topic as a means of maintenance and prevention?
Yeah, so I spoke a little earlier about not glamorizing suicide, how social media or media in general puts suicide out there. It's important not to glamorize it. If you watch a documentary about suicide, or they have to read something about it, read it alongside with them, have discussions about it. The point is to bring this up and to open up conversation about it. That is protecting our kids, giving them place to be safe with talking about it. Because heaven forbid, it does start to creep up with them somehow. They know then that it's a safe thing to come talk about. If we don't talk about it as adults, they're not going to feel like they can come up and talk to us about it. They'll chat with their friend about it. They'll, you know, Snapchat or I don't know, I'm not good with the social media stuff. Anyway, point is, you know, 50 to 90% of parents were unaware of their child's suicidal thoughts in some research studies that we reviewed. 60 to 95% of parents were unaware of a suicide attempt that their child made. That goes back to those numbers that we were talking about earlier, you know, or the idea that a suicide attempt doesn't necessarily need to end in death. It's the intention of what's going on, and it's happening much more frequently than people realize. And the communication is what is key here for that. Very specifically, let me tell you a little bit about myself. So I am a licensed professional counselor. I've been working in this field for how long? Have one daughter that has been my sole focus all these years, and feel like I'm a pretty aware person and felt I was pretty involved. And yeah, I knew my daughter was struggling. I had no idea that she was having suicidal thoughts or that she was self-injuring, but I knew that she was struggling in school when she is a very, very capable student. She was wanting to be in her room all the time, did not want to have anything to do with me. Part of these things, I'm like, okay, well, she's 14. She's getting to that age where she wants to not be with me or do these things, or, whatever it is. There were so many of the warning signs and so many, and she has some of the risk factors as well that all added up. But did I know it? Nope. Luckily, because I knew that she was struggling, I took her to a therapist, and the therapist was able to, she was able to tell the therapist, which is another really good point that I want to make, is we want our kids to have resources they can go to. And that's having some adults in their life that they can trust. So we'll talk about that, making a list or something like to that effect. But it was a horrifying, devastating experience I had with my daughter. And I thought I was doing it all right, or I was definitely trying my hardest. And it happens. And it's then how we go into the next step with it. I had to show her that I cared. I had to continually show her I care. So I had to become a safety net, right? I reached out for help, got her more intensive care than she was already getting. I didn't give up. She wanted nothing of me and would kept me at arm's length or football field's length, whatever it was, which was really hard, but I didn't give up. I just kept on, making sure that she knew that I loved her, whether she believed it or not at that time. I had to keep reaching out to that. I did blame myself, but you shouldn't. I was able to, because it was a very devastating thing, I also got my own help, my own therapy that helped me during that time. This isn't a blame thing. She had significant depression. I didn't cause her to have depression. It's something that she had, and I needed to continue to help her with that. And I needed to show to her that I had to do some self-care. We expect our kids to do self-care. We also need to do self-care. At that time, I really needed a lot of self-care. So you got to get in there and be that safety net. My daughter's now, that was when she was 14, she's now 20, and she's just now starting to come around of seeming like she might want something to do with me. No, she actually acts like she likes me again, which is really nice. But it's been a long go of it, and she still has depression, and we still work on getting her the proper help. By the way, when she was 14 and all that was going on and I knew she was struggling, I didn't ask her, are you thinking about killing yourself? Are you thinking about suicide? Do you wish you were dead? I didn't ask any of those. If I would have asked those earlier, we possibly could have had some different outcomes. And maybe she could have been coming to me more often. Maybe not, but I didn't open those channels for her to be able to come to me. Communication is really essential when it comes to mental health in our kids. If our kid's struggling, We got to be in touch with the school, sign releases so their therapist can talk to the school and the school can talk to the therapist. That's where the kids spend most of their time, and they're going to see a whole lot more sometimes than you see at home. That is a valuable support and resource that we need to utilize as much as we can. Even out in the community, if our kid is involved in something, bringing this full circle and, allowing people in their lives to support them. I'm not saying go tell everybody all the stuff that's going on with your child, but finding some select people that you can trust or that they can trust, and bring them into it so they have those support systems wherever they're going. When they're in high school, sign those releases. When they go to college, go to orientation with them. Make sure you're signing forms with your child on everything that you can that allows communication to go through all the channels. I didn't do that when my daughter went to college, because I was dealing with something that I wasn't able to necessarily be there for the orientation and things like that. So it ended up being more difficult for me to be able to support her the best that I could. Also, when they go off to school, have them check out, go to the orientation, figure out what kind of mental health services they have at the college, figure out what else there is in the community. It doesn't necessarily have to even be at the college. Sometimes people don't want to have it be part of their college experience. Maybe they want to go somewhere else. Give them whatever resources so they can make the decisions that they need to make for themselves. They're at that age where they need to take a foothold and start to do some of these things. But they're still young enough that they need us to be helping a lot of times. So making sure they have the information they need. Encourage them, if you see them struggling, to use that information and to get services if they need it. If they don't go to college and they get a job, what does their job offer? My daughter worked at Starbucks. She could get free therapy when she worked there. There's different things. So no matter where they are, look at what the resources are around you. Make clear notes about what they are. Make sure that they know what they are. They have them written down. So if they need them, they can use them. And how do they choose a mental health professional? First of all, we always want to make sure we're ruling out any medical causes for mental health concerns. So if they're really struggling, they should go to the doctor too. Something might be happening there. You need to consider, sometimes most people need to consider what kind of insurance a provider takes, what availability they have. Are they going to be able to see them next week, or is it going to be 3 months from now? Are they going to be able to see them weekly, or is it going to be, longer time? There's different, pieces of information you want to help them get. Does that professional work with the problems that your child is having? Not everybody has the same specialties. And so, sometimes we need to make sure that we're checking that out. And then after they go to the appointment, or first couple appointments, not just one, few appointments, got to give us therapists a break, but do they feel like they can connect with that person? Can they open up? Can they engage? Can they talk? Can they be forthright with that person? That relationship will develop over time. But sometimes right off the bat, someone knows, you know what? That guy reminds me of Uncle Joe, and I really don't like Uncle Joe. Whatever it is, I don't want to make light of the situation. The point is, check out, is this someone they feel like they can actually work with?
Hey, Laurel, the chat, there's a couple of folks talking a little bit about kids or adolescents who are resistant to treatment, right? Who don't want to go see a therapist. Certainly thinking about like, if you can get them to go for the first couple appointments, hopefully that can help be, that typically, I know in my experience, a lot of times kids come in and say, I'm not going to talk to her. And then after the first session or so, like things definitely get better. Any thoughts on how we can help kids to then actually attend those appointments, or how we can help parents to feel like they can, like, how hard do you push, I guess?
Well, those are really good questions. And I think getting in the door and having that fear taken out of it, maybe even let them know what it's going to be like. Call the therapist and say, okay, what's the first session going to be like? How can I help my child understand what they're going to be doing? Because some kids think, oh, they're just going to think I'm crazy, or it's going to be scary. And, walking into an appointment with Amanda, I would be just really thrilled, it would be really nice. But, they don't know what they're walking into. So helping them kind of understand what's going to be happening, and, let them know that, you don't have to share everything at once. This can be a process. The therapist doesn't have X-ray vision, and you're not going to be completely vulnerable and seen right off the bat. Helping them understand that process a little bit. But the more that we can be talking with them at home and open with them at home, the more that they're able to express themselves, the more likely they're going to be able to go into therapy too. If they are able to if you guys are able to connect, and if you can't connect, like I said before, find a few people that they feel like they could actually open up to and connect. With my daughter, what I did is we have some family friends, and she had a few of the friends that she felt like she'd go to. I talked to my daughter and the friends and said, you know what she tells you, if she doesn't want you to tell me, don't. I wanted her to have, unless she was going to try to kill herself or kill someone else. Those are, the essentials. But I wanted her to feel like she could go and have a place that I wasn't going to know what was going on, because for whatever reason, she was feeling like she couldn't open up to me a whole lot. And, part of being a teenager is that individuation where they're trying to kind of move away from parents a little bit and move towards friends a little bit. So that's a normal process as well. And so it's important to allow our kids to have their friends, particularly during COVID time and things like that as well. But I'm starting to get off topic. Did I answer your question?
Just want to be mindful of the time. We've got about 3 minutes left. I probably didn't give you enough. Sorry to rush you here at the end.
No, that's a problem. I wanted to kind of briefly go over some of these things. How do you start a conversation? We have to go into the conversation having our kids understand that it's okay to not be okay. When we ask them, are you okay? We're not expecting them to say, yeah, I'm okay. We want to seriously and genuinely hear what they're doing, how they're feeling. And when you start a conversation, start with what you actually see. What are the things that you see? What are the facts in the situation? Don't assume you know what's going on. Point out the behaviors or things that you're seeing, and then check in on it. I notice you've not been yourself lately. Is something bothering you? You seem down and spending a lot of time in your room alone. I'm here for you if you want to tell me about it. I would love to know how you've been doing recently. Can we grab a bite to eat and chat? Those are some like baselines of things to say. But really pointing out, you're not hanging out with the same friends. I'm a little worried about you just not seeming like you're enjoying things. Whatever it is, put what you see in that statement and not what you think. Don't say, are you depressed? That could, just then, push them to not necessarily be as engaged. Asking them specifically, and because depression is a very complex thing anyway, asking them, are you thinking about killing yourself is perfectly fine and important to do. Be careful of what we say. Our kids are always listening to us, right? I mean, from the get-go, they hear everything. They might have their face in the phone or a book or whatever, but they hear everything that you're doing. And so how do you talk about other people? Let's read this like it's diabetes. So 4 and 5 think it's harder to admit having diabetes than any other illness. 1 and 2 are frightened by people with diabetes. If you had diabetes and you were reading these or hearing these, this is what society is experiencing. Mental illness is ranked the top stigmatizing illness. So if we continue that conversation, if we continue putting those kind of thoughts out there, it's only making someone that's struggling with it, makes it harder for them to come forward and ask for help. They don't want to be considered crazy. They don't want to be considered nuts or psycho. So keep in mind how you're referring to mental health. Setting the stage. I want to use one word here because I know we're going low on time. Be curious with your kids. If you have to fake being curious, fake being curious. So when you're going in and starting a conversation and they tell you something that shocks you or makes you want to jump in and fix the situation, right that situation, use curiosity, ask some questions, fake it till you make it. Use that curiosity as a way, as a buffer to give yourself a little bit of time to kind of take a deep breath, collect yourself. What you're wanting to do is show these kids that you care. We want to show them that we care no matter how they're feeling, no matter what they're thinking. It's not going to change the fact that we care about them and love them. It's not that. And then there will be a time to be able to jump in and for problem solving at times. But first and foremost, we need to let them know that we care. We need to be consistent and persistent with them. We need to lead by example. You know, having a regular routine where you're bringing up difficult topics and talking about it, whatever's going on, you know, around the dinner table. What's the best thing happened to you today? What's the worst thing happened to you today? Setting the stage for that just talk in general. All right, I'm gonna go to this because I know we're out of time. The caller who said, put these in the phone, absolutely. Take a picture of this, you guys, if you don't have these numbers already. Take a picture and send it to your kids, to their phone. These are life-saving numbers. And seriously, we have kids that, you know, won't talk, but they will text. And vice versa. I have some kiddos that I work with that do not want to text, but they will talk with somebody. And if your kid is struggling, you may even want to like walk them through it. Like I mentioned, I did with some of my clients or with people that I'm doing safety plans with. Call these numbers with them. Let them take that fear out of it. Let them know what it's going to be like. Any other questions? I really appreciate you guys making statements and asking questions all along, but I'm happy to stay extra and answer any questions if anybody has them.
I know someone mentioned about, is there a way that video you shared would be able to, is that something we could maybe post on the PERC website so other folks could see it? Or I think that that could be something that could be helpful.
Oh my gosh, it's such an amazing video. And you get it on YouTube. It's basically Mayo Clinic suicide prevention, teen suicide prevention video. I can send you the link, Amanda, but it's
great. And folks, I can put that, I'll have us put it on the PERC website as well. And we can certainly have that as a way folks can take a look at that as well.
Well, here it is too. I mean, but it's just easy enough to go to YouTube but there's the link if you need it.
Great. Yes, we can stay on for a little bit if folks have some questions. I know in the chat, I was just taking a quick note. Someone asked about whether or not we have some of this programming in Dublin. I'm assuming they're maybe thinking about SOS, which yes, we do. But if you want to share it all about Dublin and their ability to use some of these services too, right?
Yeah, Centero, who you guys have as mental health providers that help the school, we trained together on SOS. Actually, we had the makers of SOS come train us at Children's Hospital, and then we trained Centero on SOS. And we've worked together actually in Dublin and for 1 year, and they've been doing it year after year without us after that as well. So they're very skilled in SOS, and they do this, I think, every year in Dublin as well.
Laurel, I actually work for the suicide hotline as a volunteer.
Great.
And I just wanted to thank you for all that Nationwide does for kids. It's our referral source, our main referral source, because you guys do an amazing job.
Thank you very much. I appreciate you saying so. I'm very proud to work there.
You should be. They do an amazing job. And I don't know if this is helpful to anyone to hear, but the times that we've had to call Dublin police, they are so responsive. They get there so fast. And so I'm just really proud to live in this city. We have a lot of these resources available to our kids for help, but I just thought I'd mention that as well.
Yeah, so thank you for saying that. If your your child comes to you and is worried about a friend, and you can't find a phone number for a parent or whatever, call Dublin Police and have them do a well check. They are happy to do that, to go out and check on the family. That might be easier than trying to find someone's phone number. All these great ideas now, but thank you for that. Anything else?
Great. So again, if folks wouldn't mind going to dublinperc.org and give us some feedback on the evaluation form, that would be fantastic. We'd love to have any of you join a meeting if that would be helpful. And again, any feedback that you may give us is super helpful. We're always looking to figure out what are great, what are programs that that folks have interest in and how we can help provide that to everyone. So again, thank you so much for coming and attending. It was great. If you have any questions, I will also put Laurel's contact information on the website so that if you have any questions and want to reach out to her directly, that would be fine as well. And a copy of the slides potentially, Laurel, if that's something we could do. I think we sent those out this morning, didn't we? Did we send those out?
No, we sent out a bunch of resources, and it goes to our Center for Suicide Prevention and Research site. And there's blogs on there and different research things that we've been doing on there. Okay. I will check about the slides. I don't know if that's something that we give out or not.
Okay. Well, certainly we'll put up, once we get kind of information, we'll make sure we put the contact information for you as well as some of the resources you had sent out earlier. And that, certainly they can obviously send an email to PERC as well. We can help get that information. So thank you so much.
Wonderful. Thank you all for attending.
Great. Take care. Thanks, everybody. All right, I'm going to stop recording.